Depends on what type of knee pain. So if it's acute knee pain, which has occurred as a consequence of a certain type of activity with no pre-existing symptoms, then and it's brought forward by activity, it's subsiding at rest, but it's again at the next episode of activity, the pain continues. Sometimes associated with swelling, associated with symptoms of catching or restriction of certain movements in the knee joint, then a specialist review is required. Standard imaging investigations such as X-rays are useful, which may show some degenerative changes or some obvious bony changes in the knee joint. However, often, especially in the younger population or those who are quite fit, simple X-rays are often normal. Therefore, further investigations such as MRI scans are required, which may show intra-articular pathology either to the cartilage or to the meniscus or ligaments. If the injury has occurred as a consequence of a traumatic injury during sport, then and it's confirmed by the imaging investigations, then a plan is required to be discussed with the specialist. Especially in the older population, these tears are unlikely to heal by themselves. So therefore, surgery may be indicated. If the injury has, or if the symptoms, the knee pain has occurred as a consequence of a sport injury, which leads to a ligament tear or ligament injury, which affects the stability of the knee joint, then surgery to address that is often required and recommended in order to restore the joint stability and prevent further injuries. If the symptoms are occurring over a long period of time, and simple investigations are revealing, such as X-rays are revealing degenerative changes throughout the knee joint, then it is a choice of the patient to whether adapt or amend the lifestyle and their activities in order to preserve the joint for as long as possible. Often these degenerative symptoms, the degenerative changes which lead to these symptoms can subside, and the knee pain can subside upon change of activities. It's not always required to undergo surgery for these degenerative changes if the overall quality of life is not severely impacted. And of course, for older population, if these symptoms are affecting their quality of life and their ability to perform normal activities around the house or simple tasks as walking to the shop or walking around the house, and if their general health permits, then perhaps more activity, more surgical, more invasive surgery is probably recommended, but not often, not always required. After all, it's about quality of life, and most of these patients choose to take the conservative route before choosing to go for surgery. It depends on the type of cause for the symptoms. So we can split this into three main groups. So if it happens as a consequence of a traumatic injury, such as a sport injury, playing, for instance, just an example, rugby or football, planted foot, twisted, felt a pop, the knee swelled up, developed some restriction of range of movement. Specific investigations have revealed either a meniscal injury or ligament injury. Then, of course, there is a recommendation to address these issues, to resume or to return to previous activities. For middle-aged population, if and the surgery will involve either ligament reconstruction or meniscal repair, plus minus partial removal of the torn meniscus if it's not repairable. For the middle-aged population, if the symptoms have occurred as a consequence of a sporting injury or just a sudden onset of symptoms, are likely to be as a consequence of degenerative changes which occur due to age. Specific investigations have revealed the cause of the symptoms, which again can be either a chronic meniscal tear, which was asymptomatic until the said event, or just degenerative thinning of the articular cartilage. It's a thorough investigation and discussion with the specialist is required in order to find out the exact cause of the symptoms. Often the middle-aged population could be a problem with alignment. Sometimes we note that patients have either genovarone deformity, in other words, in layman's words, bowed legs, or genovalgum, knock knees, which are a developmental issue, and the normal use over time has brought the symptoms forward. So therefore, the type of treatment required is whether alignment could be corrected, will be restored, which often involves osteotomy surgery, for instance. But again, the surgery is the last resort. There are specific indications for offloading braces to test whether the knee symptoms are improving with these measures, and if so, then the patient would be eligible for deformity correction. That can be associated with other intra-articular procedures if and when required. However, some of these patients choose to use these offloading braces for long-term, as they feel their knee pain is well controlled and surgery is then not required for a long time. Ultimately, the third group of patients is the older population, which have developed degenerative changes or problems over many years. It's a normal process of getting old, and basically it means symptomatic onset of osteoarthritis, and the type of surgery required, if the appropriate age and level of activity, could be from deformity correction if there is any, partial knee replacement, and full total knee replacement. Knee replacement surgery is very successful in the right group of patients. It is considered to be the last resort for addressing knee pain. And as a general rule, knee replacement surgery is, at least in my practice, is recommended when no other means can be used to restore knee function and quality of life. I will always investigate thoroughly each patient and try to understand their anatomy, their alignment, lower limb alignment, and identify causes for development of knee arthritis. I see quite often in my practice that patients have usually unicompartmental knee arthritis due to a developmental issue, so axial or a skeletal developmental deformity, which in a slightly younger population can be corrected and prolong the life of their knee joint. So it's called joint preservation. However, if in presence of fairly well-aligned lower limb and persisting knee arthritis to one of the compartments, then a partial knee replacement can be recommended. For those who have three-compartmental arthritis, a full knee replacement is the recommendation as a surgical recommendation. However, surgery is, as mentioned before, the last resort. So we can try physiotherapy, specific adaptation of activities, medication to control symptoms. And often this can buy some time before deciding to choose to undergo knee replacement surgery. One has to be mindful of the lifespan of a knee replacement. A knee replacement usually lasts between 10, 15, up to 17, and quite rarely 20 years of life in the artificial knee joint. So it's very much dependent on activity, body weight, and so on. So in the recent times, we see population living longer. Therefore, it is very important to choose carefully the startup time for a knee replacement. If, for instance, someone has three-compartmental arthritis in their mid-50s, for instance, they need to be very well counseled and understand that it is expected that their new knee replacement, the new joint, will potentially last between 10 to 15 years. So they are likely to see another 1 or 2 knee replacements in their lifetime. It is well known by now that the initial knee replacement has very good results and allows them to restore or resume most of their activities. However, there are some limitations. And the second knee replacement, the revision knee replacement, which is most likely required in the future, will not have the same good outcomes as the initial one. So therefore, we reserve a full knee replacement for those cases which are not suitable for any other means, surgical means, to address their knee pain. If they have unicompartmental knee arthritis, perhaps realignment surgery, if needed, to be performed, or partial knee replacement, which has very similar outcomes to a full knee replacement, but it's a lot easier to revise in the future if and when required. Again, it depends on the type of pain. So if the pain has occurred due to over-exercise or just a simple twist or sprain whilst exercising, rest, elevation, anti-inflammatories, and perhaps some ice packs are useful. If the symptoms have occurred over a longer period of time, grumbling knee pain, which affects quality of life and sleep, then we can use topical anti-inflammatories. We can use anti-inflammatories systemically, oral intake of anti-inflammatories, and some stronger medications such as paracetamol or codeine, which are able to control most of the times the symptoms. However, they are not addressing the cause of the pain, which is either degenerative changes which have progressed or some significant trauma to the knee joint. So if the simple remedies at home, such as anti-inflammatories, resting, and ice, are not helping or not improving the symptoms significantly, then perhaps that person should seek medical attention to look into their problem.